Okay, so up next we have Amita and Jacob, who are giving us a talk on pharmacy, a career in pharmacy. Amita and Jacob will be giving us an insight into what a career in pharmacy looks like, including the exciting opportunities and sectors that are available. Right, I will leave it to you.
Thank you very much, Daisy. So as Daisy mentioned, my name's Amita, and my colleague Jacob, we will be delivering this session together, and it's all about what a career in pharmacy looks like. Next slide, please. So to summarise, we will be talking about who the pharmacy team is. We'd be interested to hear about your thoughts on pharmacy, a bit of myth busting. We'll go through the opportunities available in pharmacy, and then myself and Jacob will give a brief description about ourselves and our own personal journeys.
Thanks, Amita. So please. Just checking, can everyone hear me? Amita, can you hear me?
And I'll hand it over to Jacob for this slide.
Great. So I think the beauty of working in pharmacy is that there's not just a sole career. The pharmacy is run by a varied team. So I think we're all well aware of pharmacists, but there's also pharmacy technicians and also support staff in the actual pharmacy. And the service couldn't be provided without all three groups working together. So pharmacists are what myself and Amita are, and we trained for 4 years at university to gain our masters in pharmacy, and then followed that with a year of on-the-job training, which we call the pre-registration year. Once you complete your pre-reg year, you have to pass the pre-registration exam, and that's how you get on the pharmacy register. So pharmacist roles are really about advising patients on lifestyle, on their lifestyles and how to actually manage their medicines. We're really the experts in medicine, so we're making sure that what doctors prescribe are safe and appropriate for patients. And as you progress through a career as a pharmacist, you might specialise into certain roles, which we'll discuss later. And pharmacists are also responsible for the running of the pharmacy, i.e. making sure that everything is done in line with the law to make it safe and appropriate for the patients. So we work closely with pharmacy technicians, and they complete a 2-year training program, which is a MVQ level 3. And they're really experts at the communication, I find. So communicating with patients to gain accurate medication histories, and really drilling down to, are they taking their medicines and how do they find taking the medicines? They can also take on additional courses, so they'll be able to accuracy check medicines at the dispensing stage. And I work along some quite specialist pharmacy technicians in the hospital, so who are specialised in medication safety or teaching. And we also have pharmacy support staff, and I think that their role is the most varied, so they can manage the stocks that we hold in the pharmacy. They're the people who actually dispense the medicines, so making sure that your label has the correct directions as per the prescription. And some of them even manage the pharmacies on a day-to-day basis. And for example, in community, they're the sorts of people that will sell you the over-the-counter medicines. So in that role, you can apply for a job at any stage, and then throughout your role, you can engage in opportunities to gain extra qualifications. So we'd like to gather your thoughts. So what pops into your mind when we say pharmacy? So I'll hand over to Amita to just monitor the chat, because all I can see is the presentation. So if you could just type your thoughts into the chat box, and then we'll have a bit of a discussion about them. So I'll hand over to Amita now for some myth busting about what pharmacy actually involves.
Thanks, Jacob. So I'll talk through a bit about myth busting. Just if I'm really sorry, but I can't hear anything else that's in the presentation. So if Daisy, if you're listening, if you're able to reach out and help me, that would be wonderful. But otherwise, I'll continue and talk about some myth busting and essentially some fake words and some fake news that really I've heard being used about pharmacy. So common myths are that pharmacists only work on the high street, that actually our job only contains picking medicines from shelves, and that pharmacists just give out medicines, we stand behind the counter. There's a perception that it's not varied, it's boring, it's stressful, that actually there's no progress in the career and some sort of assimilation to being a shopkeeper. But actually, this in fact is all fake news. And I just wanted to really counter some of these. So in terms of where we work, yes, pharmacists can work right in the heart of communities, and you might find community pharmacies in the high street, but as a later slide will explain, there are so many opportunities in pharmacy and so many different sectors to work in. Working in the community is just one of those. In terms of our day-to-day role and the aspect of picking medicines from a shelf, that's a really small component of our role, and I think that part of our role is to physically supply a medicine to a patient, but actually as a pharmacist we're responsible that the medicine is essentially the right medicine. So there's hundreds and thousands of different types of medicines, and it can be really confusing as different medicines work for different conditions. Some medicines are better than others. Some change how they work depending on if the patient is taking any other medicines. And it's really our job to make sure that patients get the right medicine for them. It's also really important that the patient gets the right dose for them as an individual. So that could really depend on their age. So for example, if you had an adult and you had a small child, you wouldn't expect to give the same dose of medication to each of those two. So really, as a pharmacist, I'd be looking at that individual themselves and thinking, what's the best dose for them? And that's based on a variety of different characteristics. It can really vary depending on the type of medication. With some medicines, there's much more tailoring that needs to happen for a patient. For example, some medicines are excreted through the kidneys, and actually your kidney function might need to be taken into account to give the dose of a medication. So that's really important that we pick up on those things and best tailor the right dose of the medicine to effectively treat the condition. As a pharmacist, it's also really important that the patient receives the medication at the right time. It's essential that we continue the essential treatment, and actually some medicines have really complex dosing regimes. There's some medicines where you might have to start and stop another medication on a different day because perhaps there's an interaction that happens between the two. So it's important for us that actually we provide that level of information and that regimen to the patient so they take the medicine kind of safely and effectively. But that's just, as I said, kind of one aspect about the job of a pharmacist in terms of optimizing the medicines for patients. But there's also lots of other things that we do. You know, for example, health promotion, as well as long-term management. But I'll talk more about that in the next slide. In terms of the common myth being that it's not varied, it's boring, it's stressful, which is in fact kind of actually the opposite. It's a hugely varied job. Some roles require a lot of patient contact, some require more audit purposes. You can go into teaching, academia, research. It's so varied. And in terms of the progress in the career, there is huge opportunity to progress in your career as a pharmacist, whichever sector of pharmacy you work in. So, for example, if you work in community pharmacy, you could progress to be the superintendent pharmacist. If you work in a hospital, you could progress to either become a consultant pharmacist or a chief pharmacist. So there's so many great opportunities to progress in this career. Next slide, please, Jacob. So this slide is all about the truth. So what do we do? So in the top right-hand corner, as I mentioned before, we are really the experts in medicines, and our job is really to provide the patient with the right medicine at the right dose at the right time. We have a huge role in medication safety, but also in minor ailments. So, for example, with common coughs, colds, flu, we're really there as a resource to tap into to treat some of those conditions. In terms of health advice, there are a lot of weight management services and smoking cessation services that we can offer, and it's really crucial that we offer those right in the heart of the community. So actually giving the best opportunity for patients to come and access the services, and I think that's really important. There's a lot of emphasis on health prevention rather than cure, and I think that pharmacists are really well placed to do this. In terms of some of the aspects of our job, is that actually pharmacy it's very much a patient-facing role. Whether that's a pharmacist who works in GP practice, as you can see through the picture, where they're monitoring someone's blood pressure and therefore giving advice on their blood pressure and therefore their blood pressure medication. And it's very much a patient-facing role, and it's highly varied as well. And in terms of who we work with, so we work as part of the multidisciplinary team. So that might include working with doctors, nurses, dietitians. We work very closely with the MTT team to really provide the best care that we can to patients. So, for example, with doctors, we might advise on the best treatment for patients according to treatment guidelines and treatment pathways. With nurses, we might give best advice on how to administer doses of medication, particularly medicines that have to be given intravenously, so through the veins. And also working really closely with dietitians as well. There are some pharmacists who specialise in parenteral nutrition, which is essentially nutrition through the veins, and really important to work closely with our multidisciplinary team to really provide the most effective treatments for patients. Next slide, please. And I'll hand over to Jacob for the next slide.
So I'm just double checking that you can hear me. I think there was an issue with the mic, but I think it's sorted. So where do we work? I mean, the the things that spring to mind are your hospital pharmacists and your community pharmacists. So, for example, your hospital pharmacists were out on the wards, working as part of the multidisciplinary team, as Amita said, providing advice at ward level to both doctors and nurses. In community, you're on the ground, really interacting with patients on a day-to-day basis, and also managing their health holistically in terms of lifestyle advice. As time's gone on, the roles of the pharmacist have diversified. GP practice is a really expanding area where pharmacists are starting to work. For example, you might be able to book in with your pharmacist to have your blood pressure checked, and then tweak your blood pressure medicines according to that to make sure that your treatment is safe and effective. Pharmacists work in industry and research in terms of looking at what new medicines are on the horizon, clinical trials and things like that, to make sure that new medicines are safe when they're brought out. Technical services is a massive area as well, and that can range from production in sterile environments to aseptic production, and making sure like things like chemotherapy is made up appropriately to be administered to patients. We have remote services, and that could range for working for 111, triaging patients, making sure they're referred to the right people, but also home care services. So in terms of arranging supplies for medicines like injections to go out to patients' homes to be administered. Academia is a big area, for example, working in universities, but also within the hospitals to teach other healthcare practitioners about the safe use of medicines. Mental health is a big area as well, working in specialist psychiatric units. And the role of the care home pharmacist is also expanding at the moment, in terms of reviewing the sorts of medicines that elderly people are on. A lot of elderly people can end up throughout their life on a multitude of medicines, and that's what we call polypharmacy. So the role of the care home pharmacist is really key at reviewing those medicines and making sure that they're still appropriate for them and not potentially causing them any undue harm. Making sure that their medicines are giving them benefit which outweighs any of the potential side effects respective to their age. There's even specialist pharmacist-led clinics now within hospitals and other areas. For example, renal pharmacists who manage transplant medicines for those who have had kidney transplants, for example. So the opportunities for pharmacists are very varied as well. Once you start off as a pharmacist, you can branch off into many different areas, as we've discussed, and then specialise into certain areas. So on an education point of view, we have things that are called teacher practitioners, and that's a new role that's split between academia and clinical services. So they, for example, might work 3 days in the university teaching new students, and then 2 days in the hospital providing clinical services or teaching other healthcare practitioners. Digital transformation is a huge area of development at the moment, spurred on even more by the current pandemic, where we need to think about how can we provide our services differently. So it's all about creating new systems for medicines to optimize safety and effectiveness. We have robots now that help us dispense, and there's even schemes that do that at ward level for administration for patients. And we've seen a huge push towards electronic prescribing now, and getting rid of the old paper charts that you might see in a hospital, because EPMA, which is electronic prescribing and administration, is a lot more streamlined and less risk of error. We have clinical fellowships, which Amita will talk more about to you later, as she has actually undergone one of those courses. And as I said earlier, our clinical roles can specialise into certain places. For example, we have nutrition pharmacists who can prescribe and review total parental nutrition for those who can't take anything orally. And we also have people who specialise into certain areas such as surgery or cardiology or endocrine, things like that. And then they can really drill down into diagnosis, similar to a doctor, but also working alongside the other members of the team to really make sure that that patient's treatment is appropriate for them. And as we touched on earlier, there's leadership and management. So in the community pharmacies, you might like to become a superintendent pharmacist, which manages the whole chain of your high street chemists, or a chief pharmacist in a hospital trust, making sure that your team is providing the best services across all of the wards. There's also leadership opportunities at a national level. For example, you have Public Health England pharmacists who work on national projects aimed at improving the health of the nation. So I'll hand back to Amita now to talk about herself.
Thank you, Jacob. So I'll go on to talk a bit about me and my personal journey in terms of how I became a pharmacist and my roles since becoming a pharmacist. So when I was at school, the A-levels I took were a mixture of science and maths, and they were very much the sort of subjects that I was interested in. I decided to get a part-time job as a member of support staff at one of my local community pharmacies. And that really sort of opened my eyes up to exactly what a role in pharmacy could look like. And working as a member of the support staff at the pharmacy, I really sort of got an idea of the different medications that were available, and not only that, but the different services that pharmacies also provide. I was able to gain some insight into different conditions, and I was able to speak to my pharmacist about the different career opportunities, and then that really prompted me to decide to apply to pharmacy at university. So I decided to pursue that. I studied pharmacy at university for 4 years, and then completed a 1-year pre-registration year. And after completing that, I decided to work in hospital pharmacy. And so I worked in hospital pharmacy for several years, and I've worked through lots of different rotations, such as general medicine, AAU, which is the acute admissions ward, care of the elderly, surgery. And it's such a great opportunity to work through all those different rotations in hospital, and those specialist wards within that. That provided me a lot of insight in terms of actually what the common surgeries were, for example, if I was working on a surgical ward, and therefore what the different types of medication that patients would then need to then treat that. Working in general medicine was really, really exciting, and also working on an acute admissions ward and that's a very different pace. Because it's a very fast-paced ward, and actually I think working across those different specialties has given me a really strong foundation in pharmacy. I then decided to work in aseptics for a bit. So as Jacob mentioned, that was one of the areas which pharmacists can work in, and that was a really interesting experience, and actually very different to those rotations that I had worked in on the ward. So aseptics, as Jacob mentioned, was part of technical services, and here we manufacture chemotherapy, but we also provided the parenteral nutrition service to the hospital. So actually my role in aseptics was split. I spent part of my time providing the adult parenteral nutrition service, And this included going on ward rounds with doctors, nurses, dietitians to patients who were severely ill and weren't able to intake nutrition orally and actually had to be injected nutrition through the veins. And actually the composition of the bags and actually if the patients were suitable were part of what our team evaluated. We also looked at manufacturing chemotherapy in the technical services unit, and so that did involve putting on you might have seen it, but it's a very funky suit that you have to put on to go into a clean room, because essentially the room needs to be sterile in which you manufacture chemotherapy to those critically ill patients. And so that was a really fantastic experience. After working in aseptics, I then decided to work in electronic prescribing, and I was an EPMA pharmacist, which stands for Electronic Prescribing and Medicines Administration, where we rolled out electronic prescribing to one of the hospitals. And this was such a great opportunity because many hospitals were using paper drug charts, and actually there's a lot of additional safety benefits with electronic prescribing. So rolling that out at a hospital was challenging, but equally really exciting. And that really prompted my enthusiasm for digital care. And I then took on a role in automation and robots. And part of my role there was to install a dispensing robot in the hospital pharmacy. So there's a lot of advances that are happening in healthcare, and part of that is due to automation and the improvements that are happening in the digital space. And in pharmacy, in the area that I was working in, we looked at installing a robot that held a large proportion of our medicines, so that actually when we went to dispense them, we were able to retrieve them through the robot. And the aim of that really is to get to closed loop administration, where actually the nurses, right when they're administering drugs, right through to actually selecting the drug, actually the more automated that can be, and there are a huge safety benefits to that. And that then led me to my current role, which is as a clinical fellow, and I'm working at an organisation called Health Education England, which looks after the education and training needs of the workforce. And that's really, really different to working in a hospital, since it's working at a national organisation. And actually, I'm in a unique opportunity where I can work with really senior leaders to understand what the key national priorities are. So as you can probably see, I've had quite a varied journey in terms of my career pathway, and actually it's still evolving. I'm still learning lots of new things. But that's, in summary, a little bit about me. I'll hand back over to Jacob.
So I'll talk a bit about my journey now in pharmacy. So I think in comparison, I'm not as far along in my career as Amita is. I have only been qualified for just under 2 years. But my introduction to pharmacy started with my mum. She's a pharmacy technician, and it wouldn't be allowed nowadays, but when there was no one to look after me at the weekend, because both my mum and dad were working, I'd be brought into the pharmacy with my mum. And I was just fascinated by the world around me, the complex drug names and the advice that I could see my mum and her colleagues giving to patients. And that's what really inspired me to get into pharmacy. So I kind of tailored my education around that goal. For example, I did your science Gcses and always looking into extra opportunities in terms of healthcare. At college, I studied science and maths, similar to Amita, and I volunteered whilst I did that as an assistant in the pharmacy. So my role then was working on the hatch and actually taking in prescriptions from patients, assessing them to make sure that they were legal, And at that point, I might contact a doctor to say, look, you might need to come and correct this prescription. And then I started university at Liverpool John Moores, and I got a bank assistant job. So whilst I was at university, I was also working in the hospital dispensing medicines. And then I did my pre-registration, successfully passed the exam and qualified as a pharmacist working in hospital, and I've been there ever since. So my rotations have mainly been in specialist surgery. So the hospital I work in is a tertiary centre, which means that it's specialist in certain areas. So I've worked in vascular surgery and also oncology, particular gastro oncology. So people with cancers of the stomach or esophagus, things like that. And what I've really liked about those rotations is making sure that the medicines that they're on also hopefully prevent further need for surgery or interventions. For example, in the vascular clinics, there's a lot of patients who are very complex, have a multitude of conditions, and making small interventions in them, you can see the quality of life improvement in terms of their pain, their mobility, things like that. And it's really good to be able to advise people on the small changes that they can make about their medicines to improve their quality of life. Recently, I've also become the lead pharmacist for Discharge Lounge. So the Discharge Lounge is an area of the hospital where we send people to wait for their discharge letters and medicines to free up the hospital bed for another patient to come into. So the key thing about that is maintaining that flow and the efficacy of people being discharged from hospital. So my role in that was looking at the processes. So who is appropriate to come down to the Discharge Lounge? How long should the turnaround time be? How do we actually discharge them? And how do we dispense their medicines and counsel them when they've been taken away from the ward? So in the future, I think that I'll be looking to specialise, hopefully, into medicine safety. That's an area that I really enjoy. I'm also interested in teaching, so potentially the academia route might suit me. And I'm also really interested in improvement projects, which is why I took on the role of the Discharge Lounge pharmacist. So that might potentially be a route for me in the future. So outside of pharmacy, I'm an advocate for involving young people in healthcare. So I was a member of the NHS Youth Forum, which is a national project looking at improving the health of young people, but it was delivered by young people. And when my term on there ended, I noticed there wasn't anything at a local level in my hospital. So I created that and still lead it today. So we've got a group of really talented and really inspiring young people who will review the paediatric services of the hospital and hopefully improve it for other young people that might experience similar things. So just because I'm a pharmacist doesn't mean I can't get involved in other projects. And I'll hand over to Amita for this.
Jacob. So if you're sat there listening to our presentation and you're wondering, is a career in pharmacy for me? What I would say is that actually, if you're interested in science, if you're interested in healthcare, if you want to care for people, if you want a career that has a huge range of opportunities, and if you want an exciting and diverse career, then yes, pharmacy could be a career for you. So I'll leave it there, and we're now happy to take some questions and answers, which I believe will be facilitated through Daisy. So thank you very much.
So Zaira has asked, is there loads of feedback? Or is it okay? No, it's okay now. What grades should one potentially achieve in GCSEs to become a pharmacist or a pharmacy technician?
Thank you for that question. So I would say that essentially there are two routes, and as Jacob described, in terms of kind of, in terms of that question, and as Jacob described in terms of who makes up the pharmacy team, pharmacists that make up part of it, but pharmacy technicians also make up part of the pharmacy team. And actually the routes to both are very different. So for example, if you wanted to become a pharmacy technician, quite often you would complete your GCSEs and you would find employment at an organisation, for example, a hospital, and complete a 2-year qualification, and that's very much learning on the job. Whereas if you were to want to pursue to become a pharmacist, you would complete your GCSEs and A-levels and apply to university to become a pharmacist and undertake 4 years at university, followed by an additional year. And in terms of specifically the grades required, the grades required for both would differ. And what would be really helpful is if you went to the university websites, which specifically define what grades are needed, because actually they vary between universities. But generally speaking, they require A to C grades, and I know that's changed into the new grading system from the 1 to 9, so the corresponding grades for that. But if you want real detailed information, it would be best to go to the university websites, which will state the exact requirements for that particular university to study pharmacy. So I hope that answers that question.
Sorry, Daisy, I don't think it. We can't hear you.
That's why, sorry. Is it a good career to take with Btec Applied Science?
I can answer that, Jacob, if you want. So in terms of, sorry, I'm getting a bit of feedback. Let me just try and do so. So in terms of the Btec Applied Science, so again, probably something that would be best to go onto the university websites in terms of the actual requirements for it. What I would say is that there's a huge range of different routes to sort of get into pharmacy, and actually I'm not too sure what the Btec sort of requirements are, but the university websites will definitely state that. So it'd be best to head to the university websites on that, or potentially if you go to the UCAS website and then go to the pharmacy page on the UCAS website, that will tell you the specific Btec requirements for that too.
Thank you. Emily has asked, could a degree in biomedical science or biochemistry lead towards a career path in pharmacy, particularly more of the research and development side?
So currently, the only way to become a qualified pharmacist is to study the pharmacy degree at university, and then to take an additional year. That's currently the only route to become a qualified pharmacist. But in terms of pursuing a degree in, for example, in biomedical sciences, if you were to go down the research side of things, there might be sort of roles in research that are closely aligned to the work that we do in pharmacy, although that wouldn't necessarily lead to you becoming a pharmacist. If that makes sense, you would have to study at university and complete the pharmacy degree to then become a pharmacist, or alternatively, if you wanted to become a pharmacy technician, even after having completed the biomedical degree, you would then need to gain employment and complete a 2-year on-the-job program, and then become a registered pharmacy technician. Jacob, I don't know if you had anything that you wanted to add at all.
So in terms of biomed, I went to uni with quite a few people who studied biomed, and they've gone on to work in roles where they work closely, as Amita said, with pharmacists, but aren't actually qualified pharmacists, because you do have to do the pharmacy degree to become a registered pharmacist. In terms of technicians, I work with a lot of pharmacy technicians who their degree is in medicine, who've then gone on to do their pre-registration year as a technician, and then the 2-year-long course to qualify as a registered pharmacy technician. And then we work really closely together to provide the services to our patients.
Okay, thank you. Katie has asked whether work experience is important for pharmacy before applying to university.
So I would say that I think work experience is really crucial for any career, just for yourself, really, just to understand actually whether you think it's a career for you. And whilst work experience isn't a mandatory field in terms of applications, in terms of your application, if you wanted to study pharmacy, there's no specific requirement that says you must have had work experience in pharmacy to apply to become, to apply to university to study pharmacy. So whilst it's not a requirement, I would say that I personally think that work experience is a wonderful opportunity to gain more insight into the career itself, and really just to help you understand a bit more about the role and your future career. So that's probably what I would say. Jacob, please feel free to add to that.
I mean, speaking from personal experience, I did a work experience placement and also worked as a volunteer in a pharmacy. And I really believe that both of those roles were key to me getting onto the actual course to become a pharmacist. But even the things I've learned from them courses still stick with me in terms of talking to patients and other skills that I learned throughout that. So as Amita said, it's not a requirement, but if you could get work experience, then I'd truly, truly recommend it.
Just to add, actually now there's lots of novel ways that work experience is now being delivered, and actually I'd keep an eye out for any places that are offering virtual work experience as well. So just be open that actually it might not be work experience in the traditional sense that might help you to understand more about pharmacy, but it might be looking at some other unique ways in which you can gain that insight too. So that's all I wanted to add on.
Afsa would like to know, how long does it normally take to move up the bands?
I think that's a really tricky question to answer, and it's a really individual. Individual thing, and I think it's very personalised to someone, and also depending on the opportunities that are available to them. I don't think there's a specific time frame in terms of, there's not usually a rule in terms of complete a certain number of years at one band, and then you progress to another band, and then you complete a certain number of years and then progress to the next band. It's actually very flexible, which I think makes pharmacy so wonderful, in the sense that actually if you wanted to spend kind of more time in one role, you absolutely can, and if you wanted to perhaps spend shorter time because there's another opportunity available, you can also do that too. So it's really flexible in that sense, which I think is wonderful. But to answer your question, there's no specific there's no specific time frame for that. So yeah, that's what I'd have to say on that front.
Kate would like to know, were you ever stuck between medicine and pharmacy? And if so, how did you decide?
Jacob?
I could answer that. So I debated it in my mind what I wanted to do for a while. So as I said in the presentation, you know, I had a good role model in pharmacy with my mum. I knew I wanted to go into healthcare, but I wasn't sure if I wanted to be a nurse, a doctor, or a pharmacist. But for me, I could see the impact that the pharmacist was having on that individual level with a patient, which inspired me to go into pharmacy. And as the roles are evolving, I think that the pharmacist role and the doctor's role are very, very similar in terms of picking up signs for diagnosis. I mean, as we said earlier about work experience, that's probably your best way to decide, and speaking to registered professionals already about how they like their role, and then you can decide what works for you. I mean, I'm a very scientific minded person, and I like to learn about how the drugs work, and that's why I went down the pharmacy route. And there's a lot of questions in the chat about which A levels are required. So the chemistry is key, about learning and understanding how the medicines work in the body, and also being mathematically minded to work out doses and complex regimes, things like that. And that's the side of it I liked, which is why I went down the pharmacy route. Yeah, Amita, do you have anything to add?
Just to say that I think that, you know, I think that medicine and pharmacy are both fantastic careers, and actually I think it's very much, as Jacob mentioned, what you personally would like from a career, and Jacob's absolutely right in terms of work experience is a really key part of that, or even speaking to healthcare professionals in both of those areas to really understand what would suit you both. I think for me, the reason why I wanted to choose pharmacy was that I really liked the role of the pharmacist within the multidisciplinary team. I really liked the fact that actually it's evolving as a profession, and perhaps previously it focused you know, it took on some of the more traditional dispensing roles. Actually, now it's becoming more clinically focused, and I really love that transition that pharmacy is going through at the moment. So I think, you know, I think in answer to your question, I think they're both absolutely fantastic careers, and really it's a very individual decision to make. So I would say definitely go with something that you feel that actually you personally would relate to more.
Thank you. Gurpreet has asked, what degree courses can you take in university to work as a pharmaceutical scientist?
Jacob?
I'm not entirely sure on that, but I potentially would guess at biomed as a course. I remember when I was looking at courses for university, forensic pharmacy was a course that was an option, and I debated with that for a long time. But for me, I wanted to be patient-facing, which is why I went with the pharmacy route rather than the lab-based route. So potentially that could be an option. But in terms of that specific course, I'm not entirely too sure. You probably have to look at the requirements on the university websites.
I agree, but because pharmaceutical science is different as a degree course to pharmacy, it's not something that I have a particularly vast amount of knowledge in. So I would definitely recommend to go onto the university websites for that, or to go onto the UCAS website to gain more information on that.
Okay, thank you. Sandra would like to know, how good are the job opportunities for pharmacy?
I'm happy to go first, Jacob, if you want.
Yeah.
So in terms of the job opportunities, you probably saw from our slides that actually there's so many opportunities in pharmacy. There's a huge amount of different, for example, even the different sectors that pharmacists can work in, and that's evolving over time as well. For example, you might have noticed that pharmacists can now work in GP practices, which is a really new and exciting role for us. So I think a short answer to your question is yes, there are a huge amount of opportunities in pharmacy, and I think it's really about kind of exploring what areas you want to work in. But I think that's something that pharmacy is really flexible in doing, that actually we're able to work across a whole range of different sectors and gain that exposure and that experience. So I think that's probably all I have to say, but I'll leave it to Jacob to see if he has anything to add.
Yeah, I think there are a lot of opportunities for jobs out there, because there are so many different sectors that you can work in as a pharmacist. And for example, if you did want to work in a hospital, but there weren't any hospital opportunities, you could work in a high street pharmacy and a community pharmacy, and the skills that you develop are so interchangeable between the different sectors that it wouldn't be detrimental to you. In fact, it would probably be beneficial. So even down the line, we see hospital pharmacists wish to move to community or to GP, and they take the skills that they've learned with them. I won't lie to you, the jobs are quite competitive, I think, but there are lots and lots of opportunities out there. Oh, I think you're on mute again, Daisy.
Sorry, Miriam has asked, could you explain a day in the life of a pharmacist? Kind of explain what your normal day would look like.
I think that's probably going to look really different for me and Jacob. I think we're probably going to have both very different takes on that. So Jacob, if you want to go first, and then I can follow after.
So my role is a ward-based pharmacist. Currently I'm on an endocrine ward, so I see a lot of diabetic patients, for example. So my day starts with, I get in and I get a list of my patients for the day, and I have a look at those new patients or who I might want to prioritise. So, for example, those who have poor kidney function, or who are elderly, or who take what we call critical medicines. I'd want to prioritise reviewing them first, just to make sure that they're prescribed safe and appropriate medicines. So when someone is admitted to hospital, we try to complete the medicines reconciliation, which involves getting a list of what medicines they took at home and comparing that to what they're prescribed in hospital, and making sure if that matches, is it appropriate? If it doesn't match, is that meant to not match? E.g., have we increased a dose of a medicine or something like that? So that's one of your main roles as a hospital pharmacist, is medicines reconciliation. You're also reviewing the drug charts of patients who are in hospital, so making sure that those who have been there for a few weeks, a few days, their medicines are still appropriate, and do they need any more supplies whilst they're in hospital, which you would organise. You're also responsible for the safe storage of the medicines on your ward, so making sure they're stored in a locked cupboard, they're not left out on the side, everything's all above board and legal. And then also a major role of the hospital pharmacist is the discharge process. So when a patient's identified that they're fit for discharge, that's around the time we'd start thinking about, okay, have they got any medicines at home? Do they need more supplies? What more information do they need about the medicines to enable them to take it correctly? So a massive, massive role is that patient communication, which we call counselling. And it's really about finding out what the patient needs about their medicines. What do they want to know about their medicines? And that just empowers them to take it in the correct way and safely. So that's what my role is on a day-to-day basis, is looking at the new patients, reviewing who's been there for a while, and processing discharges. And all of that, I work alongside the nursing team, doctors, physiotherapists, dietitians. So I never stop talking all day, talking to patients or healthcare professionals about medicines. So that is the gist of my day. So I'll hand over to Amita.
Jacob. So whilst Jacob was talking, I was thinking about what part of my career journey do I tell you about what the day in a life of a pharmacist for me looked like, because actually I feel like it's so varied, and I can't say that any day has really been the same. So it's actually a really, really tricky question. So thank you for whoever sent that question in, because it's really made me think. But if I was to give a very general overview in terms of the day in the life of a pharmacist for me currently, and my role currently is as a fellow at Health Education England. It's probably really different to what you heard from Jacob. So essentially, because I work for a national organisation who delivers education to the pharmacy workforce in a sense, a lot of what I do is go to meetings at a very senior level with sort of national leaders, and we really look at the training pathway that pharmacists are going through at the moment. So that might include meetings looking at actually the education pathway. So at the moment, the 4 years of training at university, and then the additional year, and actually looking at the components of that and what part of the curriculum that looks like, and then also the training after that. So that's sort of what my role is sort of currently at the moment. But if I was to rewind a bit and look at my role when I was working in automation and digital at my hospital, that role again was really hugely varied. But I would say my day there largely consisted of, quite similarly to Jacob, in a sense that in the morning I would very much go to the wards and review patients, optimize their medications, look at their conditions, ensure that actually their medicines adhered to kind of different treatment pathways. I would then speak to doctors to ensure that actually those medicines were the best medicines they could be. I would speak to nurses about how best to give them, and speak to patients as well about how best to take them. And then once I had reviewed my patients, I would then look at the electronic prescribing system, and look at optimizing that. So, for example, if there were medications on the prescribing system, I would ensure that they were up to date in terms of the new alerts that had come out, in terms of the safety recommendations that were advised, to make sure that they were translated onto the electronic system, and to also ensure that we maintained our drug catalogue. And it really involved speaking to a wide variety of people, so not only consultants, pharmacists, kind of a huge range of different healthcare professionals, but also with IT specialists and technicians in that respect, to really optimize the electronic system as well. So I hope that's sort of giving you some insights.
Yes, thank you. I think we've got time for one more question. Sandra has asked, which sector of pharmacy did you both like working in and why?
I'll let you go first.
I mean, for me, from the start, I always wanted to do hospital pharmacy. And I felt that in a hospital pharmacy, I was able to use my clinical knowledge of how medicines worked alongside a doctor at the point of prescribing to make sure that the patient is on the correct medicine for them. And whilst you can definitely still do that in community by phoning the GP and stuff, I wanted to be on the wards and in that kind of environment. So that's where I preferred working. I mean, in community, I think that what is amazing is that you can be really, really, in touch with that patient, develop a really good relationship with them when they're routinely attending your pharmacy. And in that sense, you can gain a way to optimize their medicines. So it's both interchangeable, but for me, it was the hospital environment that I liked, working directly next to the doctors and nurses. And that's why I chose to do that route as opposed to community. But as our roles evolve, you're finding a lot more community pharmacists are much more connected and much more linked up with other healthcare practitioners, which I think historically they perhaps weren't as linked up. So it's good to see that that's improving. Amita?
Thanks, Jacob. So for me, in terms of sort of sector, I would say that I really liked working in the digital space, and I have a huge interest in digital, and that can be across a variety of different sectors. Although I worked in digital within hospital setting, actually now I'm looking at digital in accordance to education and actually the impact of digital on that education framework. So I would probably say that my interest lies within digital and automation, and I think that that's a really interesting space because we all know how much of an impact the digital kind of advancements are going to make to healthcare professionals, and I think that it's going to really essentially change the way we deliver care to patients. I think that kind of grabbing both hands and taking the opportunities that advancements in digital care give to us as healthcare professions is something that I'm really passionate about, because I just think that there are so many opportunities out there, and ultimately what they do is that they really help us as healthcare professionals provide the best care that we can to patients, in the most safe and effective way, and also in terms of the patients, allowing them to access us in a way that's most accessible. And I think that you can probably see some of that through COVID-19 and what the pandemic has brought us, and in fact has made some huge leaps in terms of some of those digital services that we're able to deliver through. So I would probably say that that's where my passion lies within pharmacy.
Thank you. We've got time for today, but it was really great to meet you, and it was a really interesting talk, and I hope everyone got answers to their questions. So yes, thank you.